So I have 15 minutes just to talk a bit about the challenge and the horizons for the bioregion of Catalonia. Uh, Most of you know what we are, what Biocat is. So Biocat, we are a public-private foundation that was created 20 years ago. So we are celebrating this year our 20th anniversary. It's important to highlight that we are this public-private foundation. So this means that we are neutral, transversal. We are representing the whole bioregion ecosystem, and this allows us, for example, to present every year this annual bioregion report, where you can see this is only a summary that you can see here the most important indicators. Just very briefly, in our ecosystem, we have more than 1,650 companies, nearly 100 of different research institutions, and this means research centers, university hospitals, great infrastructures, scientific parks, etc. We represent also our sector in Catalonia around the 7.5 percentage of the GDP in Catalonia, and also in population employed in Catalonia. The global turnover of this sector in Catalonia is nearly the 50,000 million euros. And when we talk about research, no, and about the most important assets in clinical, you know, and you can see on the top on the right that Catalonia is one of the most important ecosystems attracting clinical trials. We are in the 4th position in Europe, the 7th in the world, with these more than 5,700 active clinical trials. This means that more than the 90% of the total amount of clinical trials developed in Spain, there is one Catalan hospital involved there. And when we go more focused in advanced therapies, we can see also that we are in these top positions in clinical trials in advanced therapies. And in this case, there is an important part of these clinical trials that are promoted by the public institutions. 75% of them are promoted by pharma companies, but 25% is promoted by some of the most important hospitals that we have here in Catalonia. So this is only a summary. I do not want to focus in the bioregion report. It's accessible in Catalan, Spanish, and English in our website, but I want to go further to the challenge. No, this is a summary of the healthcare challenge that have been identified for the biopharma stakeholders for the next 10 years. Now you can see here there's nothing new for you. We have the challenge related with aging population, those related with mental and brain health, also more specifically in cancer. How we are seeing how the antimicrobial resistance is increasing. Also how we can try to face and try to solve the health inequities, those gaps that we have in the different populations, but also when we compare the metropolitan areas with those that are more rural. So and also in rare diseases, for the small amount of population that has each of these diseases. These are the healthcare challenge from the side of the pharma, of the industry. And I want to show you how we faced a few years ago in Biocat the most important challenge for the bioregion of Catalonia. And for me, it's important to highlight that these are the challenges for the bioregion, because this was identified after nearly 1 year of discussions with the most important stakeholders in Catalonia. And this means the policymakers, this means the public administration, also the pharma companies, startups, the spin-offs, also hospital research centers. So our idea at that moment was to identify the challenge for the whole ecosystem and where most of us need to be involved trying to solve them. So I will try to go a bit further to each of one, but the summary is healthcare system transformation, business growth and consolidation, new therapeutic strategies, also talent attraction and development, and BioRegion international positioning, and very transversal to each of them. And this is something that also Monse mentioned during her speech. Sustainability, the planetary health. So we need to face all the individual challenge, taking into account that we need to do things better and very aligned with the sustainability objectives that we have in Europe. So if we go through each of these challenges, the first one, healthcare system transformation. What we identify here is that after pandemics, we saw that the public healthcare system needs to be transformed. So we are having an aging population, we are having chronicities, we have a lot of challenge to face, and we need to transform the system because the total amount of funding is limited, and things will not change if we not try to do something different, no? And the way to think to do these things different are through the adoption of innovation, no? And this is one of the main challenges that for sure we will talk about it not only today but during the next session the next week. But how we can identify those innovations that can help the healthcare system to be transformed, and how we can go faster through the adoption and implementation of this innovation. The second challenge for the bioregion is the business growth and consolidation. What we have seen during the last 20 years is how we have increased our capabilities in tech transfer technology, also in the creation of startups and spin-offs. Yesterday we had a great meeting with all the tech transfer offices in Catalonia, and we saw how 20 years ago we only had in our ecosystem 30 spin-offs in innovation and health, and nowadays we have more than 300. So only in 20 years we have multiplied for 10 the number of spin-offs. So this means that we are transferring better technology, that we increase in these capabilities, but we need to go further on landing the capabilities for industrialization, for production, for the production of new products, of new therapies, and this is not the reason of this challenge. How we can go further to make and to scale up our ecosystem with these capabilities for production and manufacturing. The third one is new therapeutic strategies, and this for sure is very directly aligned with personalized medicine, with advanced therapies. So we see that we are developing great therapies on the first phases in clinical. We are seeing so great examples and very successful that how these therapies are starting arriving to our patients. And the most important example here in Catalonia are the CAR-Ts from the hospital clinic that we saw how we were able during the last years to arrive to more than 500 patients, and this is very successful in comparison with the rest of countries in Europe, but we need to make this higher and more accessible. So this means that trying to find new ways of public-private collaborations, new ways of production, new ways of also of reimbursement, trying to find this resharing between both the public health system and also the industry. So this is for sure one of the most important challenges in Europe, and we consider that we are in a very great position in Catalonia to try to help to solve that. The fourth one is talent attraction and development. We need to upskill and reskill our people, and this means not only the professionals within the healthcare system, clinicians, etc., but also those that are working in industry, in the startups. So we need to generate attract and retain this specialized talent that we need in Catalonia, so we can increase our ecosystem and to grow. But if we do not have the people and the talent, we will have a problem in the future. So for us, this is also a great challenge. And the fifth one is the international positioning. And this not only means to put in the map Catalonia saying, oh, we are doing things very well. This means that we want to be sit on the tables, around the tables where the most important challenges in Europe are being discussed and are being tried to be solved. So we want to be there as a key stakeholder as Catalonia, because we have these capabilities, and trying not to make things together, because the most important challenge for the future, we cannot solve them alone. And we can, and this is a great example. Precise, Preciseu is a great example of that. How we can, or we need to construct these networks and these alignments between different regions and try to solve together this global challenge. So after this challenge, what we did in Biocat then was to identify our 5 lines with very specific programs, initiatives. No, I will not explain each of them. All of them are available in our website, but the idea was the first one, identify the challenge, and then those programs, tools, and initiatives that we had to start developing. But I wanna just finish with that all those initiatives are under these core strategic programs. So we have here ATMPs. We are very focused, as I said before, in how to increase and scale up these therapies, making them affordable and accessible for the healthcare systems. We are also, since 4 years ago, coordinating a program that is trying to solve together with the healthcare system, with Aquastic Salud and other agencies in Catalonia, also Axio, how to make faster the adoption of this innovation. And we also were working in the past with different regions in Europe, trying to see and identify the gaps for the implementation of the European health data space. And this is something now that is being led by Aquas, how to create the office that will make feasible, the access for the data for the secondary use. And all those things are very well aligned with Preciseu, as a whole program. And the two last slides is just for you to see that ATMP Catalonia is a network in Catalonia with now, I think that we are 75 entities, where we try to connect all the people, all the institutions, public and private both, that are working in advanced therapies, trying to fill those gaps, not at the first phases for the development and research, but when we try to scale the map, not to go through the clinical phases to arrive to the market. No, we are trying to do different initiatives together with the most important stakeholders in Catalonia, try to construct and to make that together with other regions in Europe, for sure, like the Nordics and Germany, France, etc. And my last slide is that one. I will not go through what is our Catalan Health System Innovation Access Program, that is called PASS. I think that is something that you will solve during today and the next day. But I just want to focus that moreover to the different initiatives that are being developed within this program, not to support the companies and startups to arrive to the healthcare system. For me, is very important this picture, that is something that was developed by CatSalud, our public healthcare system provider, that was to identify the most important needs that we have in our healthcare system. So for the first time, what we are trying to do is how to support the innovation to arrive to the market, but taking into account which are the needs and the priorities of our healthcare system. For us, it's important not to connect the solutions with the needs, and I think that that's one of the most important challenges that maybe we will discuss further these days. So Monse, I finish here. I thought that I'm in time, so thank you so much, and I will try to stop sharing.